The medications that are commonly prescribed to your loved one are donepezil. This is the generic name, and Aricept is the brand name. Donepezil is prescribed for all stages of dementia. Rivastigmine and galantamine, these are prescribed for mild to moderate dementia. Donepezil, rivastigmine, and galantamine are in the same medication classification that increase the levels of acetylcholine. It's a neurotransmitter important for memory and thinking skills. Memantine is typically prescribed for moderate to severe dementia. Namenda is the brand name of memantine. Memantine helps regulate the glutamate neurotransmitter in the brain, which is involved in memory, learning, and addressing symptoms of confusion, agitation, and aggression. If you noticed after eating in a Chinese buffet or in an Asian restaurant with Asian food with MSG, you feel sleepy. This is the effect of the glutamate component in the MSG added in the food. MSG is a food taste enhancer. That is why no surprise that we eat so much food when we go to these places. The same effect of memantine in the brain of your loved one with Alzheimer's and dementia. It regulates the glutamate in the brain to promote calming effect to behaviors of agitation and aggression. A combination of donepezil and memantine is also prescribed as needed for moderate and severe stage of dementia. In cases of severe agitation, aggression, or psychosis, antipsychotic medication can be prescribed with careful consideration and monitoring of potential side effects. As a dementia coach and a physical therapist advocating for holistic approach in Alzheimer's and dementia care, here is my take on these prescription medications. Non-pharmacological approaches should be considered first, and the prescription medication as a last resort. Prescription medications to manage symptoms of dementia should only be given as needed and not to use as a maintenance medication unless it is really deemed necessary. I worked with doctors specializing in Alzheimer's and dementia care. They prescribe prescription medication to patients with increased confusion, agitation, and aggression for the main purpose of protecting the patients from hurting themselves and the caregiver. The medication is given to the patient to address the symptoms temporarily, all right, and only for a period of time. A good doctor then readdress the patient without taking the medication. If the patient is doing good without the medication, then the prescription medication is discharged, followed by a root cause analysis, root cause assessment of the outburst behavior. What caused this behavior? Is it identifying the triggering factors? Is it pain or discomfort or fear that your loved one could not verbalize? Or is it an undiagnosed illness? And symptoms like urinary tract infection, dehydration, they are feeling tired, increasing the agitation and confusion, lack of sleep, which could also trigger the negative behavior of your loved one in a brain with dementia. When your loved one's doctor do this process in addressing the outburst behaviors, you have a good and very knowledgeable, skilled doctor in the area of Alzheimer's and dementia care. I will give you a good example of the importance of addressing the root cause of the symptoms to address the problem with effective and practical solution. Years ago, before I learned about holistic medical intervention, I experienced joint pains, pain in my hips and my knees. I was about 37 years old. That's kind of young, right? And I gained so much weight. So my doctor prescribed me a prescription for joint pain. It was helping me with the pain when I took the medication. But if I did not take the pain pill, I still have the pain. So the prescription medication was not actually treating my problem. It was only masking the pain, the joint pain. So what is the root cause of my joint pain? I was overweight. I was carrying so much extra body weight that my joints wear out and my body's response was pain. I was 37. I was in my younger and active years. I wished that my doctor advised me to take the pain medication temporarily while I'm working on a weight loss program with exercise and healthier diet. So I took the pain medication for years. And that's what we do, what we're told, right? In the doctor's office. It became my maintenance prescription medication until I figured out myself that weight loss program was what I actually needed all along to address my joint pain. So the same thing could happen to your loved one. They could be prescribed a prescription medication to address dementia symptom, and it became a maintenance medication for them when it was not really and truly needed to be taken long term. So, what are the non-pharmacological holistic approaches out there that you could consider for your loved one to address their challenging behaviors associated with dementia? Now, this is the part where a dementia consultant and a licensed physical therapist like me can assist you in assessing the root cause of your loved one's outburst behaviors, the challenging behaviors. Addressing the pain, for example, or discomfort could be as simple as proper sitting on a wheelchair or proper bed positioning in bed. When they become less mobile or they can no longer move around and walk. Hydration is important to prevent urinary tract infection and increased confusion. Dehydration can trigger and can cause increased agitation and confusion to your loved one. And this is also true for a normal brain. With dehydration, we get the headache, we experience the mild confusion. All right? Touch therapy is a calming technique that can soothe your loved one with the gentle strokes in the hand or other part of the body. Aromatherapy, using scented candles, a quiet room to promote sleep and rest, because rest and sleep is so important for your loved one. Music therapy. Music stimulates the emotion part of the brain, and it's and it resulting to a calming effect. So, in a normal brain, we listen, it really boosts our energy, our positive mood. So the same thing with your loved one with dementia. Reminiscing technique. Sometimes your loved one just need a moment and a time with you. Reminisce with them with the good memories, redirecting them away from that negative attention, negative behavior, and you know it gives a calming effect to them, reminiscing good memories. Talk to your loved one's doctor about brain and memory boosters, supplements like magnesium and B vitamins. Also, check with your doctor what are the brain foods that can promote brain health, improve the memory, and the behavior and the mood of your loved one. Exercise. Take your loved one for a walk if they can still do it. You are promoting the release of the natural relaxing hormone in the brain with exercise, which aid good sleep and good mood. These are just a few of the holistic approaches that I mentioned. Remember, a good doctor will listen to you and will work with you in establishing a more holistic medical intervention for your loved one because they know that these prescription medications for Alzheimer's and dementia are considered high risk medications, which mean that these medications have a high possibility of your loved one experiencing the potential side effects with these medications. Be empowered dementia caregivers. Be the advocate to choose the holistic approaches in addressing outburst challenging behaviors of your loved one and the prescription medication as a last resort. This is Risa Carlton, your dementia coach and physical therapist. Till next time.